Aloha, this is Everyday Wellness and I am Dr. Lisa Kim. Today we're joined by Dr. Kristen Coles, a naturopathic physician, and we'll be continuing on from our last show on therapeutic uses of whole foods. Well, thank you for joining us today.
Yes,
and welcome.
thank you.
Okay, great. Well, I would like to continue on with our show from last time and this time it's going to be on inflammation. You had just given us a elixir for the inflammation. For the viewers who's missed that, they can always go back to our last show on olelo.com and .org and be able to find that show and get the recipe for the elixir for the anti-inflammatory. Well, can you tell us a little bit about, there's some physiology behind this whole inflammation and pain. Can you give us a little background on this?
Yeah, inflammation is a critical process that occurs in the body. And it is a natural process that occurs in the body, actually. When we cut ourselves, the process of inflammation is what helps stimulate healing.
Right.
It is a natural process. We have to have inflammation in our body for things to heal. Right. Now, I liken inflammation to an analogy of a house and a kitchen. Okay. We have a stove, and that stove, we should be able to turn a little bit of heat on, and we should be able to boil our water. And that amount of heat is the perfect amount of heat to get the job done, boil our water. Right. That's like inflammation in a natural, normal, functioning body. We have a little bit of inflammatory response as needed to fulfill the process of healing, etc. Right. Now, the process of inflammation gone awry is when we turn the stove on and we forget about the stove and we leave it on for 5 hours, and all of a sudden the heat catches the dish rag hanging next to the stove. The dish rag lights on fire and it starts spreading through our cabinets, and next thing we know, we have a major problem on our hands. We have a fire out of control. This is inflammation in the bad sense, and this happens in the body as well. In fact, it is happening at more and more amounts of people are we seeing these inflammatory reactions that are getting a little bit out of control. Cancer, autoimmune, dementia. Right. Many, many chronic diseases have a root in inflammation.
Well, a lot of these diseases, they don't just start overnight. So how does one know what a chronic inflammation looks like? Because they may know, they know about the acute inflammation because it comes and goes. But then how long does inflammation last before you say, oh, this is definitely chronic and this could lead to something else in the body?
Well, the thing with chronic inflammation is that we don't always know that the process is occurring for sometimes a number of years. As we go through life and we start to get things like aches and pains and those kind of things, that's a marker of inflammation over time. Acute inflammation, yes, you're right. People know right away because we're going to get a fever, we're going to get redness, we're going to get a noticeable skin reaction, swelling. Fever, swelling, anything like that, and that's noticeable known inflammation. One of the things that I do when I look at the patients that I see, I do a lot of different blood work, and I will look for specific markers of chronic inflammation in the blood work. And there are some very, non-expensive blood tests that can be run to see what is their level of systemic inflammation. Now, at the point someone becomes diagnosed with a disease, whatever it may be, Crohn's disease, ulcerative colitis, lupus, cancer, cervical dysplasia, whatever it might be, at that point we know that inflammation has kind of become out of control. And if people aren't paying attention to small signs, and they can actually be very small and hard to distinguish unless they're really doing their due diligence at looking at blood work and looking at their diet, then it can be tough to pinpoint. However, I'll tell you that if your diet is not sort of complying with a mostly anti-inflammatory diet, about 80% anti-inflammatory, you can be pretty certain that you have some level of inflammation, or you will develop it if you continue on that track.
But one of the things that I have noticed is that a lot of people, when my patients come in, they assume that their doctors have done ran a blood test that's pretty much complete and that should have shown the inflammation. They don't even question it. They don't think that it's not there. So what are some of the blood tests that you run? Like, can you share with us markers that you should be looking for? Because I know for a fact that's not on regular blood tests that people bring in.
Yeah. So I will often run something that's very cheap called an ESR or a SED rate.
Right.
And this, it is so cheap, even if your insurance isn't going to cover it, it's maybe $10 out of pocket at the lab I run. Very cheap. And it's not the most specific marker.
Right.
However, it will be elevated if inflammation is out of control.
Right.
And 0 to 20 is normal. I'm ideal. I ideally like to see it less than 10 for my patients. That's a very cheap sort of easy one to run. There's more specific ones. There's something called high sensitivity CRP. This is an inflammatory marker for heart disease, among other things, but it can also show systemic inflammation. It's a lot more specific. That's a really good one to run. And then in addition to that, I'll run something called homocysteine. Homocysteine is a toxic metabolic byproduct. As it elevates in the system, there will be more inflammation.
And why is it that many of the regular blood tests does not include this?
Well, I think a lot of it boils down to insurance coverage, and people really want their insurance to cover things, and a lot of times insurance might not cover some of these if there's not a real, specific reason to enforce having that run. As to why it's not more widely done run in conventional medicine, I think that's a good question to ask them. Sometimes it flummoxes me. And the reason that I ask you that question is because inflammation, a lot of people have inflammation. They don't know it. They simply think, their pain and aches are from the aging process, or they've worked a little too hard in the last couple of weeks, and then day in, day out, this pain and aches just become normal for them. So their doctors will tell them you're getting old.
Yes.
Well, I don't buy that.
I agree with you. I agree with you. Yes. Yeah. I think knowing this whole physiology of the whole pain cycle and inflammation is going to be extremely important, and knowing your threshold, is going to be important as well, because then you'll know, is it just because you have very low tolerance for pain, or is it really something going on in your body? And that's something, if you can't answer that question, you should definitely be getting some.
So the basic anti-inflammatory diet is going to remove those. It's going to remove other triggers like alcohol. It's going to remove processed sugars. And it's going to focus a diet on lots of vegetables, lots of dark leafy greens, some low glycemic index fruits, and some lean proteins. If you are a meat eater, lean proteins would be, organic, non-hormone chicken or turkey, and fish. Fish is fish in general, but let's talk about salmon. Salmon is a superfood. It's a super anti-inflammatory food. Because the amount of omega-3 fatty acids found in fish like salmon or mackerel or sardines, that omega-3 plays a very specific role in something called the inflammatory cascade. The inflammatory cascade is a series of chemical reactions that happen in the body. They're induced by things called cytokines. And this cascade, the end result is inflammation. And associated with that is often pain. So there are things called NSAIDs, non-steroidal anti-inflammatory drugs. These NSAIDs block that cytokine inflammatory cascade. Now in your head you might think, well, that's crazy fire level. So fish have great levels of omega-3 fatty acids.
And things like mackerel, a lot of people don't eat them. That's more common in Japan and Korea, but not so much here in the Western world.
And sardines,
Right.
you know, I often recommend sardines to patients, and 9 times out of 10, I'm brought with a look of,
Yes.
I don't think so, doc. And
Right.
I'm thinking to myself, if only you knew, sardines are one of the smallest fish in the sea.
Right.
So in terms of mercury content and toxin content, they're very, very low because they can't accumulate it. They're so small.
Right.
And sardines are packaged full fish, so you're getting calcium
Right.
in addition to the sardine with the bones that are in there. I mean, sardines are a great food.
Well, one of the things I love making is like I make a sauce with sardines and some garlic and olive oil, and they're just fantastic that way because sardines will literally melt in, with the garlic, and it'll bring out this flavor that's just crazy. So that's just something that I love doing, and there are ways you can make things that doesn't smell like fish.
Right.
And that's I have a little niece who will not eat any kind of fish except for canned tuna fish. And that's one of the things I did for her was I cooked it, with olive oil and garlic, and she couldn't even tell that there were sardines in it.
Perfect.
Yeah, and you can do the same thing with anchovies and all different types of fish. So as far as any other types of food, like, what specific greens do you recommend for anti-inflammatory?
Specific greens, always organic. And if you can get the deep, dark, leafy greens, our kales, our collard greens. Collard greens are incredible. They're like, second tier to kale, but really they're just as powerful. They'll pack a punch in terms of their nutrition and their antioxidants and their vitamin mineral content. Then, of course, in addition to our leafy greens, we really want to think about our herbs. Our herbs are where we have a lot of anti-inflammatory power.
Okay.
We've talked a little bit about turmeric. Turmeric root has a component in it called curcumin. And curcumin is a powerful, powerful inflammation modulator. And the interesting thing with curcumin is that its molecular structure, when you look at it next to many, many different herbs and spices, all of those herbs and spices have that same molecular structure, just in kind of different variations.
Right.
So what that tells us is that our herbs and our culinary spices will pack such a powerful punch. We just need to utilize them.
Right.
And they've done studies in America, and the amount of culinary spices that we use is staggeringly low compared to other countries, compared to India, Asian cooking. The spices in curry, curry alone is anti-inflammatory.
Absolutely. Right.
So really incorporating, if you could just incorporate some curcumin and some ginger in your day-to-day cooking.
And I challenge my patients, my viewers, to go out and buy something they have never bought before, like vegetables. They don't know what they are and how to cook with them, but you can always learn. You can ask somebody, you can Google nowadays. And so I've challenged them to go out and buy a new veggie every week, just one a week, of something that you don't buy, something other than celery, onions, and tomatoes, right?
And lettuce,
Yes, and lettuce, right? And then, I also challenge them to use some kind of spices that doesn't come from a bottle, but that comes from the real thing, and learn to cook with them.
Yes.
And use them,
absolutely.
right?
I mean, everybody should do that.
Right, exactly. Well, I would like to go on to the whole immune support because now, sometimes there's the cold and flu season, but sometimes people get sick no matter what time of the year it is. And clearly this tells you that their immune system is really compromised or low. And so what can we do with our food system to help with the immune boosting?
You touched on a good point. Really, the average healthy person should get a cold one time a year. That's the sign of a healthy functioning immune system. A little bit of a tune-up once a year because our immune system thrives on little tune-ups.
Right.
But getting repeat cold after repeat cold after repeat cold after repeat cold, that is not a healthy functioning immune system.
Right.
And if someone comes into my office with that going on, I'm going to do a lot more digging into the reason and the causes underlying what's going on there. But in terms of the diet, there's a number of really great substances that we can incorporate and use that will really help, you know, get that immune system at a higher functioning level.
Right, right.
One of the ones that I really like are the medicinal mushrooms. Things like our shiitakes.
Right.
Shiitake mushroom is incredible. It has antiviral properties, it has anti-cancer properties, it has polysaccharides. Polysaccharides will help stimulate a very specific arm of our immune system to act very quickly against viral, bacterial, cancer cells and kill them.
Incredible.
And we want that. Those are our NK cells, and we want them functioning at the highest level possible.
Right.
And shiitake, our medicinal mushrooms, have so many polysaccharides, they will, you know, really help do that.
Right, and a lot of people are very familiar with things like cremini mushrooms or white mushrooms, but the shiitake mushrooms, they do have a little bit of different taste to it, and then they pretty much will try to avoid that just because they're not familiar with it. But your palate can always be taught. And also another thing is, you know, my favorite thing to do with shiitake is with bok choy. And I just take a little bit of sesame seed oil and I just cook up the mushrooms and the shiitake mushrooms, and then I'll put some chopped bok choy and a little bit of sea salt, and that just makes the most delicious meal because there's the mushrooms have so much flavor.
They really do.
So there are many different ways that you can cook them, so you don't have to have that. Some people call it pungent taste, and which is something that you should be eating anyhow. Can you share with us Dr. Bastier's immune soup?